आप जब ठीक हो जाओगे ना, जब हम घर जाएंगे, घर जाके मैं आपको लेके जाऊंगी यहाँ पे। चलो ठीक। क्या हुआ? क्या हुआ आपको? क्या हुआ? क्या हुआ? You okay? हाँ नहीं। एक मिनट। नहीं।
So, as you just saw, a patient who was reading the newspaper and talking to the relative became unresponsive all of a sudden, and the relative ran out of the room so as to fetch the nursing staff or the duty doctor. So, what will you do if you are the first responder? I mean, you are the nursing staff or the duty doctor. So, what will you do and how you save this life? So, think about it. Till that time, I'll introduce myself. I'm Dr. Chirag Madan, working as an intensivist ICU consultant at Apollo Hospital, New Delhi. I'm also BLS and ACLS instructor certified by AHA, that is American Heart Association. And throughout the world, everyone follows the guidelines for the BLS and ACLS laid by AHA. And this is a very important topic for all the medicos around the world. I mean, we are working in this hospital environment, and God has bestowed and God has given us the responsibility to save a life. And in fact, I'll say everyone, I mean the lay persons also, they should also know the basic steps of BLS, that is a basic life support, so as to save a life. So let's start. In this video, I will talk about how to manage or how to save a life either outside the hospital or whenever you are inside the hospital as well. I mean, because many a times they are victims on the road, they are victims or in your neighborhood, your near and dear ones. So you need to know the steps, the exact steps, how you follow. Because if you don't follow the steps, if you don't do the BLS correctly, the patient might lose the precious time. So first we'll talk about outside the hospital. Let's say there is a fire in a house in your neighborhood and you are there. So what will you do? And there is some good friend of you who is in that house. So what will you do? Think about it. So I know there is a James Bond in your heart, but actually you should not go inside the firehouse. You need to call the fire brigade for that, because whenever you are in these kind of scenarios, the other scenario could be your near and dear or any third person is drowned in a pool of water and you don't know the swimming. So never dive into that water. The main funda is to save a life, to save another life, you have to save yourself as well. So the first point is always the scene safety of the rescuer first, that means you, and then the scene safety of the victim. You got my point? First is, the first step of BLS is always a scene safety. Now, let's say this happens in a hospital setup. I mean, there's no fire, there's no water. So whether we need to do scene safety or not? Yes, it is required. So you just need to wear the mask and the gloves. So that is the scene safety, because you have the option, right? And nowadays we are having this COVID scenario. So mask is a must, right? So as to protect yourself first. Okay, so first step which we discussed is the scene safety. Now coming on to the next step. The next step is checking the response of the patient. Let's see how the nursing staff does.
Sister, please see what happened to my patient.
Ma'am, are you okay? Are you okay?
Okay, the nursing staff came into the room. She was wearing a mask. She checked the response of a patient. Whenever you need to check the response, always tap on the shoulder of the patient. Never shake the patient. Because many a times whenever I'm taking the class or whenever I'm seeing my juniors, my nursing staff doing the response check, they sometimes try to shake the patient, because the patient could be having some kind of cervical injury, or let's say you are on the roadside, so patient might be having trauma to the cervical area. So in those cases you can exaggerate that injury. The best is approach the patient from the front and tap on the shoulder of the patient and be loud enough in the language which the patient can understand.
Ma'am, are you okay? Are you okay?
So the next step is call for help. Now let's take a scenario. You are having a walk in the morning around 5 a.m. and adult male collapses in front of you. So what will you do? I mean, you are all alone on the road. So first of all, you look here and there and you'll see and say, anybody there to help, right? If no one is available, then you have to take out your mobile, as we all are using smartphones. So just dial a number and put the phone on the speaker mode and carry on your steps of the BLS, right? Whereas if someone is standing over there, some help is there, so you can just ask that person to call the ambulance and give the details. And what are the details? First is the number of casualties. Second, the approximate age of the patient, whether it is adult or pediatrics, that's it. Third is very, very important, that is the exact and precise location. It should not be like come to the Lajpat Nagar. It should be that you give some landmark. I mean the showroom, the shop, or the pull or the bridge, something like that, right? So as to not waste the precious time of the patient. Okay. And the fourth thing which you ask for is to get an AED, that is automated external defibrillator. I'll talk about AED in my later part of this video, so keep watching. So this is call for help when you are outside the hospital. Whereas now if we talk about inside the hospital, you announce a code blue. Anybody can announce a code blue, right? And in a code blue, first of all you get advanced team, and secondly there is a crash cart. Crash cart has everything in it. I mean the emergency drugs, the equipments, the monitor, and the defibrillator. Very, very important part, right? So this was about call for help. Now let's see how our nursing staff does this call for help.
Can you call somebody for help, please, first?
Sister, what?
Please announce code blue, get a defibrillator and intubation trolley and dialing mask first.
Yes, ma'am.
So she asked the other nursing staff to get all the emergency things. I mean, in this video, I'm not showing the crash cart. In this video, we will be just talking about the basic life support, that is the BLS. In my next video, obviously, I'll talk about the ACLS, in which we'll use all the gadgets, all the equipments, all the emergency drugs, right? So now, we have discussed 3 steps. First is scene safety. Second, checking the response of the patient. And third, call for help. Outside the hospital, ambulance. Inside the hospital, ERS or EMS, I mean emergency response services and emergency medical services, or RRT is also used, rapid response team. So these are the 3 terms which are used, and mainly you announce the code blue as we discussed, right? Now coming on to the next step. Now you check for the pulse and breathing simultaneously for 5 to 10 seconds. And the pulse which we palpate is always the central pulse. Mind you, it is the central pulse, right? So either the carotid or the femoral pulse. Okay, never palpate the radial or the brachial or the dorsalis. So no peripheral pulse, only either the carotid or femoral. I mean, and why I'm using femoral? Because in some cases, whenever there is dressing a burn patient, or there is a operation in the head and neck area, or there is a central line and dialysis catheter on both the sides, so in these kind of scenarios you go for a femoral pulse, right? Otherwise, always try to go for carotid pulse. Now how to palpate the carotid pulse? One hand over the forehead of the patient so as to stabilize the neck, because unresponsive patient loses his or her tone of the neck. Secondly, using 2 or 3 fingers of the other hand, go in the midline, feel the thyroid and slide your fingers in the groove between the trachea and the sternocleidomastoid like this, and you palpate it for 5 to 10 seconds. And this is done by saying 1001, 1002, 1003, 1004 like this. Why? Because in these kind of scenarios you are seeing the response of the patient, and maybe you are not wearing a watch, and so as to determine how much time has elapsed, you just say 1001, because the time taken to pronounce 1001 or 1000 is almost equivalent to 1 second. So that is the reason we have to say 1001, 1002, right? Okay, now this is about the pulse. The second is you have to check the breathing of the patient as well simultaneously. So you go down in the axis of the patient and see the breathing, the minimal rise of the chest and the abdomen, the to and fro movement, right? Because if you see from above, many a times in cases of obese patient or respiratory depression, or in cases where a patient is wearing a thick layer of clothes in winters, so you're not able to appreciate the breathing of the patient. So you go in the axis and see the to and fro, the minimal to and fro movement of the chest and the abdomen, right? Whether the patient is breathing or not. And secondly, you can have the advantage, you can hear and feel the voice, the air from the mouth of the patient. Although nowadays we don't prefer in COVID scenarios, but yeah, you can hear slight sound in cases of foreign body obstruction. So now let's see how our nursing staff checks the pulse and the breathing of the patient.
1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008. No pulse, no breathing. Immediately start CPR.
After you have evaluated the patient is unresponsive, having no breath, no pulse, then obviously you have to start the CPR, right? Now, before showing you the steps, how to perform it, you need to know the high quality CPR, the components of it. So the first and foremost is put the patient on a hard and flat surface, right? Second, the rate of chest compression. It is 100 to 120 per minute. Third, the depth. It is 5 to 6 centimeters, or if you talk about in inches, it is 2 to 2.4 inches. And I'm talking about adult population, right? Then fourth, allow recall of the chest, right? And the fifth is minimizing interruption to less than 10 seconds. And there is also another point that avoid hyperventilation. So the first 5 points are very, very important. You have to keep in mind while performing a CPR. Now, before starting a chest compression, you have to expose the patient fully, right? And you have to locate the hand position. We have the hard bone, which is the sternum, and at the back to support we have the vertebrae, so as to compress hard in between the sternum and the vertebrae, right? So that is the reason we press in the center of the chest, and that too in the lower half of the sternum, right? Okay, so this is the position, and so as to see in a patient, just see the imaginary intermammary line, right? Then the position of your hands. The hand should be interlocked. I'll show you in this video. And the elbows should be straight and locked. So it is straight and locked. Okay, let's see this video. Place a hard and flat board under the patient. Expose the patient fully. Jump onto the bed of the patient. Locate the landmark for the hand position. Now interlock your fingers of the hand. As you can see, the elbows are relaxed right now. Now this is straight and locked. And the shoulders are exactly above the patient's chest. The fingers of the lower hand should be elevated from the patient's chest.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 16, 17, 18, 19, 20, 25, 26, 27, 28, 29, 30.
So the next step is the airway, to maintain the patency of airway. So the sequence which we follow in a BLS scenario is CAB. C stands for circulation, A stands for airway, and B for breathing, right? So now this A is very, very, very important, and which is very commonly missed. This A is to maintain the patency of an airway. And why is it important? Because let's see, you have made a seal with a mask and you are insufflating, you are giving the breath through a bag. So all the air which is not able to go inside the trachea is going into the esophagus and will for sure insufflate the stomach of the patient. And after some time, the patient will regurge and aspirate, complicating the scenario. And now this is for sure, if you are able to resuscitate, you are making sure that patient lands up into the ICU with the aspiration pneumonitis, right? So never miss this step of maintaining the airway patency. So it is a very simple step. I mean, just a simple maneuver which is called as head tilt chin lift maneuver, right? Secondly, if a patient is having cervical injury or cervical trauma, in these kind of scenarios you don't do head tilt and chin lift. In these kind of scenarios you go for jaw thrust maneuver. I mean, you don't need to know about this. I mean, in this video I'll talk more about it in the ACLS video, but for this jaw thrust you need a third assistant who will do a manual inline stabilization. I mean, there should be no movement at the cervical level. So you just have your fingers at the back of the jaw and you protrude or do the chin outside or upwards so that the lower incisors are outwards than the upper incisors, right? So this is just so as to make the airway patent. And why we are doing it? Because whenever the patient is unresponsive, tongue falls back and all this soft tissue over here, this gets laxed and goes on to the posterior pharyngeal wall, collapsing the airway, right? So as to make that space, we either go for head tilt chin lift, and in cases of cervical injury, suspected, even with the suspected cervical injury, we go for jaw thrust maneuver, right? So this is the A, that is the airway. Now comes the B, CAB. B stands for breathing. Now you give breath in a ratio of 30:2, 30 chest compressions and 2 breath, right? After making a good seal of the mask. So now before that you need to know that mask to be placed, the apex goes at the bridge of the nose and the lower margin goes in the groove between the lower lip and the chin, and you hold the mask with C and E technique, right? I have shown this how to hold a mask in my another video on how to intubate. You can check the link in the description box below, right? Okay, so the mask you hold in a C and E technique. C stands for compression of the mask onto the face of patient, and you make a C with your index finger and a thumb, and these 3 fingers make an E, right? So as to elevate the jaw like this, as you have seen in this video. Okay, this is called as head tilt chin lift maneuver.
6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30.
Now hold the mask in C and E technique and tilt the head. Now 1001, 1002, 1003. So 2 breaths over 3 seconds. After every 2 minutes or 5 cycles, you rotate among yourself. The person who is giving the breath will come onto the other side and start the compression, and the person who was giving the compression will go on the head end and give the breath, right? And the movement should be in the same direction if possible, so as to avoid the collision and to minimize the interruption. Now, while performing CPR, let's say a person brings an AED. Now, what will you do? Will you stop? Will you wait? Or will you carry out your CPR? Let's see in this video. 1001, 1002, 1003.
1, 2, 3, 4, 5, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21.
Remove clothes from patient's chest. Patient's chest is bare. Open gray plastic case and peel off white adhesive pads. Carefully at the pictures on the white adhesive pads. Peel one white pad from the gray case. Place pad exactly as shown. Press firmly to bare skin. When the first pad is in place, peel the second pad. Place pad exactly as shown. Stay clear of patient. Analyzing heart rhythm. Stay clear of patient. Analyzing heart rhythm. Shock advised. Stay clear of patient. Press the flashing orange button now. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR.
So after switching it on, it will give a prompt, please attach the pads to the patient's bare chest. So, and it is the diagram is also made on those pads. So one just over here below the right clavicle and the other lateral to the left nipple, like this, right? And after that, AED will analyze the rhythm and it will say, please do not touch the patient, AED is analyzing the rhythm. After that, if it is a shockable rhythm, and there are only two shockable rhythms first of all, VF, that is ventricular fibrillation, the other is pulseless ventricular tachycardia. But in the BLS, you don't have to use your mind, you don't have to see whether it is a VF or a pulseless VT. I mean, AED is there to help you out. We will talk more about it in the ACLS video, in my next video. Okay, so whenever there is a shockable rhythm, AED will give a prompt, this is a shockable rhythm, you need to shock, and there will be a flashing light button. So before giving or before pressing the shock button, you need to see and say, everybody clear, all clear, and then press the shocking light button or the orange light button, right? And after giving shock, what is your next step? Resume the CPR, right? Do remember, after a defibrillator shock, resume the CPR for next 2 minutes and then switch over. Continue this cycle till the signs of life. That means till patient moans, groans or shows any kind of movement, or till the time advanced team arrives, or till you achieve ROSC, that is return of spontaneous circulation, right? Okay. So that was all about basic life support. Now I would like to say thanks to Dr. Rakesh Kumar, who is my mentor and actually who taught me this BLS, and not to me, to lakhs of doctors and nursing staff. And also thanks to Dr. Sunil Arora and team AMF. Now I would also like to say thanks to these lovely ladies who actually helped me record this video. Miss Simi Rajan, Miss Ruchi Girdhar, Miss Deepa Maria and Miss Priyanka. And thank you so much guys for watching this video, and keep loving and liking our content. Bye bye, take care.